Hello, I'm Dr. Judy Salerno, President of the New York Academy of Medicine. Thank you for joining us today for our Around the Table series, where we discuss issues related to health equity, the heart of our mission, with specific relevance to the times we are living in today. While discussion and exchange of information is critical, more importantly, we also share actions we can take together. After each program, we offer resources and recommend action steps you can take, all so you can engage and help us move closer to our shared mission to advance health equity. We hope you will listen in, engage, and take action, because making meaningful change will take all of us working together. I'm pleased to be here today with Dr. Wayne Riley, President of SUNY Downstate Health Sciences University and Chair of NYAM's Board of Trustees. Welcome, Dr. Riley.
Welcome. Delighted to be with you, Dr. Salerno. It's wonderful to join you for this very important topic that is consistent with the New York Academy of Medicine's action-oriented programming and agenda. Today we're tackling a critically important issue, as we do with many issues here at the New York Academy of Medicine. But this one takes on special relevance during this time, where we're now focusing on the well-being and mental health of healthcare workers, physicians, and others. And I must say, Judy, what could be more important than ensuring that our caregivers, those wonderful professionals who have been taking care of patients all over New York City, all over the United States of America, indeed all over the world, we need to focus on their health and their well-being. And we know there's been challenges. And so, again, our workforce, the most important thing we have in healthcare, Judy, is our people. And we have to care about the well-being and mental health of the people we work with, because they are indeed the most critical element of the healthcare system.
Well, you know, Wayne, this was an issue even before COVID-19 struck, and a critical issue. And like with so many others, the pandemic really exacerbated the problem of mental health for healthcare workers. Let's start with looking at the data. We're looking at statistics from the April 2021 Washington Post Frontline Healthcare Workers Survey. 62% of all frontline healthcare workers say worry or stress related to COVID-19 has a negative impact on their mental health, with young professionals under 30 years old being the most impacted at an astounding 75% rate. 56% of all healthcare workers say that worry or stress related to COVID-19 has caused them to experience trouble with sleeping or sleeping too much, frequent headaches or stomach aches, or increased alcohol or drug use. And burnout rates are also worrisome. And again, those under 30 experience the highest rate at 69%. Prior to COVID, burnout was relatively consistent in the mid 40%, but this dramatic increase is concerning. And lastly, 20% say they thought they needed mental health services but did not get them. We've seen this number as high as 70% in another study. Dr. Riley, can you put this into the context of how these mental health challenges play out in the healthcare environment?
Well, Judy, these statistics that you just mentioned are worrisome for many reasons. Obviously, clearly we see the impact of COVID-19 on the mental health of healthcare workers and physicians. The burnout phenomenon, as you just mentioned, was here before COVID, but clearly has been exacerbated. The fact that we had a 20-point percentile increase in burnout rates as reported in those under 30 which are sort of the critical component of our healthcare system, those sort of early mid-career professionals that we depend on so significantly, to have that level of burnout is again quite sobering. The other thing that strikes me is that these statistics really do call for health systems and health organizations to play a role, and not for us to project this on just to the individuals who are reporting and admitting that they are stressed and burned out. This is really a job for those of us who lead and manage healthcare organizations and institutions to, first of all, have an awareness about this, and again, not to stigmatize those who come forward, who freely admit, because we want folks to freely admit that they're feeling burned out, stressed out, worn out, whatever appellation you want to put on it. So again, I think this is the statistics are again quite revealing about where we are, and more importantly, where we likely need to go to address this issue.
Yeah, so the very real impact of mental health challenges for frontline workers will be shared with us today by our guest, Corey Feist. Corey is the Chief Executive Officer of the University of Virginia Physicians Group, the medical group practice of UVA Health, comprised of over 1,200 physicians and advanced practice providers. He also holds an adjunct faculty appointment at UVA Darden School of Business, where he recently taught a course entitled Managing in a Pandemic, the Challenge of COVID-19. Corey is also the brother-in-law of Dr. Lorna Breen, who was a NYAM Fellow and Director of Emergency Medicine at the New York Presbyterian Allen Hospital in northern Manhattan. Dr. Breen died by suicide during the early months of the pandemic in New York last spring. We welcome Corey to share the story of Dr. Breen and to talk about his co-founding of the Dr. Lorna Breen Heroes Foundation with Lorna's sister Jennifer, that has been making incredible strides in addressing mental health and the needs of mental health needs for healthcare providers. Welcome, Corey.
Welcome.
Thank you so much for having me. Thank you, Dr. Salerno and Riley, and to the entire New York Academy of Medicine. It's a really special to be with you today.
So we are going to begin with a segment that you filmed with your wife, Jennifer, on the Today Show recently.
It's been just over a year since the unthinkable happened.
She was my right arm and my left arm. I used to call her my twin, my sister, my other spouse. We were attached at the hip forever. So it's been a real challenge.
A challenge that Jennifer and Corey Feist are meeting by making it their mission to help other healthcare workers, creating the Dr. Lorna Breen Heroes Foundation, and working with their Senator Tim Kaine on legislation that aims to reduce and prevent suicide and burnout among healthcare professionals.
Let's pass this bill and show that we care about our healers and are committed to providing them the resources and the culture they need to keep healing.
It took a lot of courage in those first days of just stunned grief for you to speak out. What has driven you all this time and since those early days?
Savannah, I believe that this could have been avoided. That's what's driven me. And if we can help somebody else in the healthcare profession avoid an outcome like my sister had, this will have all been worth it.
Jennifer's 49-year-old sister Lorna died by suicide last April after first fighting the flood of COVID-19 patients coming into her New York City emergency room.
The volume of death and dying that they experienced was something that they'd never seen in their career.
And then battling the virus herself.
The more you learn about Lorna, the more unfathomable this is. What have you come to believe or understand about what led to her passing?
What I know today is the same thing I knew even before my sister died, which was that she got sick with COVID and it affected her brain. The tragedy is she had enough of her faculties to know that if she raised her hand as a physician and said, I can't think, I can't work, I need help, it could have been devastating to her career. We know now exactly the same thing I knew a year ago, which is that it was the combination of COVID and the culture in medicine that killed my sister.
While more than 8 in 10 emergency room physicians like Dr. Breen reported feeling more stressed since the pandemic, nearly half polled said they did not feel comfortable seeking mental health treatment, with over 70% saying there's a stigma in the workplace surrounding getting help.
It seems like in our culture, we talk about mental health all the time and that the stigma has really faded away. But in medicine, that stigma is still there.
Mm-hmm. It's there and it's strong. It is a well-established premise in healthcare that you do not seek mental health care. You just don't. We've heard.
And why? Why?
It's because of the licensing. It's because of the credentialing. And also it's because of your potential harm to your reputation as somebody who can't take it. You know, I will tell you, Savannah, one of the real struggles with my sister was that she thought she was going to lose her license. And what we learned after she died is that New York State has some of the best licensing laws in the United States. And so my question is, why didn't she know that?
Doctors are licensed by the state they practice in, and in some states, the applications ask probing questions about whether they've been treated for mental illness. At times, experts say in violation of the American with Disabilities Act.
Only one state, and that is the state of Mississippi, has the best possible questions. It literally says, we recognize there's a connection there between your taking care of yourself and your quality of care. We want you to attest to us that you're doing that and you're taking care of yourself. We need 49 more of those to happen across the country.
The Feists and their foundation are working to eliminate any barrier to seeking help, just as healthcare workers across the country begin to come to grips with what they've experienced in the past year, a year when they've been more than just doctors and nurses.
We're also asking them to, say the rosary with a dying patient, which is a story I heard from somebody who couldn't be with her father when he was dying. And there was a nurse who said the rosary with him every day. So we're blurring these lines.
Are you worried that we're on the verge of a new crisis, a mental health crisis for healthcare workers?
Oh, there's no doubt in my mind. And there's significant data to back that up. In the heat of trauma, people are just focused on getting through it. It's when things calm down. It's when you relax. It's when you can take a breath. That's when the real problems start. And so, yes, we are so thankful for the vaccines and we are thrilled. The fact of the matter is these people have been in the battle for a year now. And now is the time that we really need to focus on the people who have been taking care of us for the last year.
I look at you two. I think about meeting you a year ago in the depths of your grief. And I look now at what you have already accomplished. What do you think Lorna would have thought of her baby sister and how hard you've worked on her behalf?
I think she would love it. I think my sister was here for a reason, and maybe this is it. We have made changes, Savannah. We've heard from people who have changed the way they live because they heard what happened to my sister, and I think she would love it.
As you heard from Jennifer, following the death of Dr. Lorna Breen and this outcrying of support that we heard from across the world and very, very intensely in the United States, is that we created the Dr. Lorna Breen Heroes Foundation, which is a 501c3 nonprofit. And we decided early on that the goal of the foundation would be to protect and care for the well-being of healthcare professionals. Our national efforts have been focused this past year on eliminating the stigma and professional barriers that prevent clinicians from seeking mental health support, and to embed system-wide resources to support healthcare professionals at all levels. As Jennifer said in the piece from the Today Show, if we could just help one individual, we would have felt that we would have done our job. We've heard from so many individuals, not just one individual since we founded, but one I want to share with because want to read from a message we received from this physician because it's so poignant and right on point to the issues that clinicians have every day. We received this on the eve of Thanksgiving in 2020. The physician says, "Today I want to say how thankful I am that the Heroes Foundation exists. I'm sure you now understand some of the restrictions that exist which prevent physicians from reaching out for the help we need. Lorna's death was what pushed me to get help, the details of which I still don't talk about because I continue to fear it will be held against me when renewing licensure or getting credentialed. I finally saw my physical safety as more important than my psychological safety, something that in retrospect seemed impossible after a life of delayed gratification, personal sacrifice, and moral injury. Every time I see a picture of Lorna, I see myself. I see my residents. I see my colleagues. After years of working with colleagues and residents, I know that this culture is the rule, not the exception. We white knuckle it until we are drowning. Too often people look back and say, they seemed fine. Of course, we're not fine." When I read that, I sat back and shared it with Jennifer, and I said, "So looks like we got our one. Are we done?" And she said, "Absolutely not. We're just getting started." So in this past year, we've really been focusing on three main issues for the Lorna Breen Foundation. First, amplifying the issues as far and wide as we can for anyone who will listen. We've impacted in that effort over 70 million people through interviews, through social media, through national publications, through the 100+ articles that have covered her story, through publications of our own, like on the National Best Hospitals Day, drafting an op-ed and publishing that in U.S. News and World Report, calling on rating agencies and others to value the well-being of the workforce as a component of what makes the best hospital in America. Recently publishing in Modern Healthcare, publishing recently also in CNN, on The Hill, the Boston Globe, with the National Academy of Medicine, and the list goes on and on. But in that effort, what we've learned is bringing awareness is not enough, and amplifying these messages are not enough. So, as you heard in that piece from the Today Show, we've also been working on a strong advocacy effort. And we are thrilled to share that the Dr. Lorna Breen Healthcare Provider Protection Act has now been passed by the Senate Help Committee on May 25th and is likely to be passed by the full Senate very soon, and then ultimately the House of Representatives. The Dr. Lorna Breen Healthcare Provider Protection Act provides for $140 million in new funds in first of its kind legislation to prevent healthcare professional burnout, suicide, and bolster the mental health among healthcare workers. It starts by providing healthcare dollars to the new workforce and the upcoming workforce, those nursing students, those medical students, those healthcare professionals. It also provides those resources to the current workforce, as well as a national awareness campaign. And finally, it has a study provision which calls for a comprehensive review of all of the causes of burnout and suicide in this country of our clinical workforce. And that's critically important because in that effort, it will allow us to really examine thoroughly these state licensure issues, as well as the multitude of other issues that reinforce the stigma and prevent the workforce from getting the help they need. Finally, we've been working on education in a robust effort to make sure that the tools that are known in existence right now to help mitigate burnout, to help support well-being, get into the hands of the healthcare leaders who need to utilize them across their workforce right now. In April of 2021, we launched the All-In Wellbeing First for Healthcare initiative, recognizing that before you can achieve the triple aim in medicine of access, quality, and reduced cost, first you need to take care of the well-being of the workforce. We've launched that with over 200 organizations who have already signed on to say, we want to be part of this movement to change the culture in medicine and to accelerate the adoption of tools into their workforce to support the clinician well-being. As was previously stated, the well-being of our workforce has to be paramount for every single healthcare leader in this country. And so I'm thrilled to be here with you all today. I'm thrilled to talk more about the work that we've been doing and bring solutions to the hands of the healthcare leaders who need them now. Thank you for taking this time with me, and thank you for inviting me to present with you today.
Well, thank you, Corey. I know Dr. Salerno and I express our deep appreciation to you and your wife for your courage, your conviction, and your passion to remember Dr. Breen in this very impactful way. So kudos to you. I have a first question that I think you're quite expert at dealing with. You're CEO of a large physician group at one of the premier academic health science centers, storied academic health science centers in the country. Judy and I both know many friends and colleagues at UVA Health System and the College of Medicine there. What are some of the best practices from your perspective, having overseen a very large, very talented group of physicians that support the work of the University of Virginia Health System? What are some of the best practices from your perspective that organizations should take a look at to address this issue? Because sometimes healthcare administrators, they kind of, almost want to throw up their hands and say, oh, this is one of those problems we can never really get our hands on. But I suspect you think differently.
Yeah, thank you, Dr. Riley. It is a great question. And there are tools that are out there. And I think that's actually the critical part of this conversation, because we do not need to reinvent the wheel to a large part. As you indicated in your opening remarks, the workforce has actually been experiencing burnout for quite some time. And so because of that, there has been quite a bit of research as to solutions to that issue. I also want to point out, before I share this best practices, though, that we have at least 2, if not 3 issues going on in the workforce right now. First, as we talked about, is we've got burnout, and burnout is not a mental health condition. It's a workplace condition, and it is largely driven by the work environment. And so we need to change the work environment and provide the supports in the work environment to mitigate that burnout. But the second is really, as Jennifer said in our piece with Savannah Guthrie, is this issue about trauma and what we know about trauma and the PTSD and depression and other things that happen as a result of trauma. We've got a whole cohort of physicians and nurses and techs and other healthcare professionals who have experienced trauma like no one has experienced before in healthcare. Now, it's akin to what the military has experienced in many cases by going off to war, but we've effectively sent a whole part of our workforce off to war for this last year, and now we need to come back and support them with mental health supports and other awareness efforts. So let me talk first about what healthcare systems can do, irrespective of whether you're trying to assess and determine how to support the burnt out workforce or the traumatized workforce. And the very first thing that they can do is make an assessment of where the workforce is right now. The AMA published early in the COVID, its Coping with COVID-19 survey. It is a free survey. It is accessible to any health system in this country, and it assesses the full workforce, not just the physicians, if you will. So, and it does a great job by looking at not only the causes of and measuring the burnout, but also the causes. But it also asks the workforce what kind of solutions and supports are they looking for. So it provides, in a way, a roadmap for action by health systems. Did I mention that it costs no money? So this is a free tool published by the AMA as part of its mission-based work, and it is accessible to any health system in this country. So I would say, first and foremost, measure the current state of the workforce if you haven't already. The second thing I would say is that health systems really need to focus on at least 3 areas. And I'll take those in order of things that are maybe easier to do. The first is to have the supports in place to provide through either an employee assistance program or a peer support program or licensed mental health services, supports to get aid to the workforce right now. Whether those workers are burnt out or they have experienced trauma, we've got to have that infrastructure around them. Now, as you said earlier, Dr. Riley, in your opening comments, though, I think what's critical here, and this is the harder part of the work, is that hospitals and health systems need to recognize that they need to play an active role in retooling the operational environment to support the well-being of the workforce. That's the harder work. That is recognizing that what we're not trying to do is make stronger canaries. We're trying to redesign the coal mine, to borrow an analogy that Jennifer and I used in our US News and World Report article here. And what we've heard so many times repeatedly from the workforce across the country and the world this year is, don't just give me another meditation app and try to make me more resilient. We've got to redesign the workplace. And so that second leg, which is much more challenging, but there are steps that hospitals and health systems can take right now, are to look at operational improvements to decrease the administrative burden on the clinicians. Now, what do we know about the burnout research? The burnout research shows that the electronic medical record is the #1 contributor towards burnout pre-pandemic. So I would direct all hospital CEOs and chief technology officers to be evaluating the utilization of their electronic medical record right now. It is the electronic medical record that is the first place I would direct everyone to, because there's often data that shows the utilization of the electronic medical record and deviations from kind of standard practice, or at least peers. And so when you look at the data that shows what your departments, which your clinical departments are doing that are outside of the normal work time, also known as pajama time in the industry, we need to look first there and try to bring tools, whether there's enhanced training, embedded builders for revising the electronic medical record. But those are some key tools that can be done in the electronic medical record right now. Also looking at clinic efficiency and the operating rooms as places where are big sources of stress for the workforce. Anything really that gets between a clinician and her or his patient are going to be causes, if you will, of burnout. So I would start in the electronic medical record. And then finally, the third thing, and this is the long-term work, is the culture work. We have an opportunity here to co-create a new culture in medicine, a culture that fosters innovation in problem solving, where those closest to the problem are given the autonomy and the authority to make change, a culture where peers and leadership come together to support each other and recognize that taking a break and seeking help is a universal sign of strength, not of weakness. So those are the main areas and the best practices that I would encourage all of our health systems across the country to start with.
That's an incredible amount of information and a lot for us to do. And yes, thank you for making sure that we get this message and we stay focused on what is really important. And I couldn't agree with you more as a clinician about the electronic medical record. Right. Can we take just a little step back? I think that even we health professionals have some ideas about what a person with struggling with mental health issues, a person who has suicidal ideation, appears like. And tell us a little bit about Lorna, because she seemed to defy all those stereotypes. And I think particularly in medicine, we put on a persona that, you know, maybe masks a lot of the symptoms that would be obvious to others who were closer.
Sure. Thank you for that question. Lorna was the toughest person I've ever met. And so, as I've said repeatedly, if this can happen to Lorna, it can happen to any healthcare professional. It can happen to any person. Lorna was a very unique individual in that she had this wonderful spirit to conquer the world and to take every opportunity to expose herself to this country, and the world. So she would take these amazing ski trips. She'd pre-plan these ski trips every year, more than anybody I'd ever met. She would go study for her board exams in Croatia or other places, all by herself, just to experience another world. In her 30s, she took up playing the cello as part of an adult group of newcomers to music, having never done it before, understanding that it was very challenging. She was very active in her church. She was an incredible aunt to 8 nieces and nephews. And so in that way, she was very unique as her name. But in many ways, she was a very typical physician, working her entire life to get to the place that she was at. And she was really at the pinnacle of her career, having been in an academic institution, the place that she wanted to practice, the field that she wanted to practice, and really starting at an early age, developing the resume and the skills to achieve those goals. So being at Columbia, being at New York Presbyterian were all of her life goals, and she was living that. Now, what is really important for people to recognize about what happened to her is, I think, two things. First is the speed with which it occurred. We were on vacation with Lorna in March. We were skiing in Big Sky, Montana. We had an amazing time. She was trying to manage the onset of COVID remotely, having already scheduled this time off. But we were already starting to see the stress and on her. But she was she was at the top of her game. There was no sign of any mental health issues at all. She then went back and within a handful of days contracted the disease. And when she contracted the disease, like many were contracting the disease early on, she went home and she tried to basically convalesce at home. She was never admitted. She had a moderate case of COVID. But what she did was, during that whole time, when she wasn't exhausted and sleeping, she was trying to continue to work, like many healthcare professionals do, or many leaders do, where you feel like you don't need to give yourself that time because you can still be online and you can still take phone calls, even though you're really, really sick. So she was very, very sick. She lost a lot of weight. And then she went right back into the workforce when she had been afebrile for only about 48 hours. And she did that because of her passion to take care of patients. She knew that many of her workers were going out. And so she was very, she needed to get back into the workplace. She was scheduled for 9 12-hour shifts in a row. And the moment she returned to work, this is really that second thing that I want to talk about, is it started the feelings about not being able to keep up and the professional pressure that she felt, that was much of which was self-imposed, was she articulated to us, everyone can recognize that I can't keep up. I can't believe I can't keep up in a pandemic. This is what I trained my whole life for. I'm a failure. And she started to use language around that. Now, for Jennifer and I, who were talking to her every single day because we were so concerned about her, because the pandemic was still so new and New York was really ground zero, we started to hear language coming out of her in those early days, really those days back, that was very atypical for her. But it also was very typical of what we hear from others, which is, I cannot show any weakness at all, period, end of story. I can't, I've heard from so many health professionals who were pregnant or postpartum when they were in residency, who, were sick and nauseated on rounds and had to step into the ladies' room and get sick and then get right back to rounds, and just never could show a sign of weakness. That was exactly what Lorna was trying to exhibit, was this sign of strength, but she was exhausted emotionally and physically. And then all of a sudden, this negative talk was really starting to take over, to a point where she called us on one day and said, I can't get out of my chair. And that was when we knew we had a serious problem. And that is when we called her friends who were nearby to intervene immediately. New York was locked down, so we could not physically get there. And Jennifer coordinated an entire help chain to get her out of New York City, a help chain of cars, basically friends from New York driving her south, where another friend in Philadelphia picked her up, to drive her south to Baltimore, where Jennifer picked her up on the side of 695. But throughout that, really, it was about a week or two. It was not months. It was not years. She went from being in a place where she was having a conversation like we're having today at a very high level to really almost being catatonic and not able to function. And that speed, happening at that speed to a person who we would have thought would be the toughest of the tough, was just absolute shock to us. And we've replayed it 100 times or more in our heads about what we could have done to help her earlier and sooner. And I would just say, for those in the audience who think someone needs help or think they're experiencing something, don't wait. Don't wait to ask them. Don't wait because, in that quote I read earlier, because they seem fine. Ask them, take them aside, ask them how they're really doing. Those are the key things that we've got to do right now to support each other, particularly as COVID is receding and the workforce is now going to be experiencing more and more of the symptoms of that trauma and the PTSD that so many have experienced.
Wow, an amazing story.
Yeah, amazing. Thank you for sharing a very poignant sort of experience you and Jennifer, sort of had to navigate to try to help her. I think there's a lot of wisdom in sharing that story, Corey. So, this is a difficult situation, and I know one of the goals of you and Jennifer, again, as you stated earlier, is that this doesn't happen again. That may be foolhardy to think that that's true, but let's try to get it to minimize it, and to get earlier interventions. And what a powerful sort of testimony that you and your wife have about this whole topic. And as you said, it intersected with your professional day-to-day life with your personal, and that's what makes it really, really sort of fertile ground for you and Jennifer to continue the great work you're doing. We at the New York Academy of Medicine embrace that vision, that work, and we are going to be side by side with you and Jennifer and the foundation.
Thank you so much.
Thank you, and thank you for joining us today. And we are with you. We have signed on to be a partner with you in this effort at the New York Academy of Medicine, and we hope it will spread to our many fellows and many people who will be participating in viewing this event. And as always, we want to move people to action, and I think you've given us a lot of information about how to act and how to be a part of this movement, because we really need a movement. You have started something very important and really critical to the well-being of not only the clinical workforce, but of our health systems and our ability to deliver excellent care to patients, because we have to heal our healers, as we say. So thank you so much for joining us today. It's been very special, and we stand with you.
Thank you so much to both of you for having me, and the New York family that we have experienced now in this past year of clinicians and others who have reached out to us has just been so warm and welcome, and we really feel like we couldn't have gotten here without you all. So thank you to the New York Academy, and thanks to so many in the New York family, I call you, because while we didn't meet many of these folks before Lorna's passing, we've now heard from so many about the impact of Lorna. The last thing I just want to say, because you asked me the question earlier about what health systems can do, and this is probably the one thing that I would just say to everyone who's watching: we got to just talk about these issues. Mm-hmm. Because when we put them on the table, that's when the change happens. So I appreciate this opportunity, because what I've learned more than anything in this last year is just by talking about this, it has really started to change the culture and remove the stigma. We suffered from that same stigma a year ago when Lorna died, and We didn't want to tell anyone about this, but we didn't have a choice because it had already been made public in news. And so we had a choice to make whether we would lean into this conversation or not. And we chose to lean into it. And we respect the decisions of so many who decide to respect the privacy. But the one thing I would say is our ability to talk about this has really lifted a huge weight that I can't even imagine we would have been carrying with us in the wake of such a tragedy. So speaking about this is just one simple thing. It's simple in theory, harder in practice to do. But if we could all just talk about these issues, it would go a long way to accelerating this cultural change that we all need to make.
We're paying attention, and thank you again for joining us today.
Thank you so much.
It's my pleasure to be here.
So, Dr. Riley, I think we can urge our audience to look at the resources that we will provide at the end of this presentation and to take action, because this is really a call to action for all of us who work in health systems in any capacity. We have to do better.
Absolutely, Judy. And as Corey just said, he and his wife had the courage to take this on. And I would implore all who care deeply about health and medicine of communities, who care deeply about healthcare professionals, to have the courage, as Corey said, to have these difficult conversations, to elevate the issue, put it on the table, and not stigmatize it. And that will, by doing so, I think we will contribute to progress.
Thank you. And we will see you soon with the next Around the Table presentation.